that. But before we do that, we're going to hand over to Deputy Mayor, Dr. Debbie Weeks-Bernard, who has got a few words for us.
So I can't still see Debbie in the chat, although she has messaged me to say she is here. Debbie, what if you can email me and flag what your name is under where you've logged in, I will definitely add you. But if any of the other panelists wish to introduce.
So why don't we introduce our panelists while we wait for the technical glitches to sort themselves out. Patrick Vernon, tell us 30 seconds, Patrick, about you.
Oh, hi there, everyone. People see me as a Windrush campaigner, but actually my background for many, many years, I've worked in the NHS as a senior director, worked at Civil Servant Department of Health, and I've run a number of health charities. Currently, I sit on the board of 2 NHS organisations, but I've been an active campaigner around the whole issue around the vaccine, and particularly the issue around bereavement and loss.
And Oggy?
Hello, good evening, everyone. I'm a GP based in North London. So working as a GP, been doing that for the last 9 years in my practice. I have been involved in my local vaccination program, vaccinating my care home residents and workers, as well as my local hub since we started last December. And since April this year, I've been involved with NHS England London region on the COVID vaccination program in general across London, taking part in webinars like this, question and answer sessions, one-on-one clinical conversations. And my theme is be curious and be kind. It's on my t-shirts this evening. Really happy to be here. Thank you.
Thanks very much. And Sidi?
Good afternoon, everybody. I'm Sidi Frederick, and I am currently the independent chair of the London Vaccine Legacy and Health Inequalities Programme Board. A long title, but the idea behind the creation of the board was is to use all of the lessons that we have learnt through the vaccine programme, the rollout of the programme, to use all of that learning, knowledge and intelligence to reduce health inequalities across London, which is, I'm sure, a subject that's close to all of our hearts. Until recently, I was chair of North Middlesex University Hospital NHS Trust, and I'm also currently chair of the Kent and Medway Integrated Care Board. So thank you.
Thanks very much. And Sarah?
Hi, good evening, everybody. My name is Sarah Filson. I am an infectious diseases and microbiology doctor working around London. I've been working on the front line since the very start of the pandemic at various different hospitals. I've also been involved in some clinical trials, so the recovery trial, which was a trial around treatments for COVID, and then also the vaccine trial, the Oxford AstraZeneca vaccine. Since the vaccine's been rolled out, I've been quite heavily involved in community engagement, trying to talk to people and encourage them to get vaccinated, but also just to kind of inform people and make sure that people have the right information. I'm currently on a year abroad at Harvard doing some work on health inequalities as well. So, but great to be here with everybody this evening and looking forward to this conversation.
And Millie? Oh no, Millie, you're here working for the GLA, are you? You're not actually a panelist, it's just your name appears. Hey, Hamish, I wonder if you could introduce yourself, Hamish, and perhaps I understand that you've got a 2.5-minute presentation that you're going to do for us. So perhaps we could take that next.
Thank you very much, Michael, and good evening, everyone. My name is Hamish Mohammed. I'm an infectious diseases epidemiologist and a consultant epidemiologist at the UK Health Security Agency. I primarily focus on sexual health, but like many others at the UK HSA, spent a large part of 2020 in the frontline public health response to COVID-19. That's about understanding the scale of COVID and the inequalities that have arisen and come to light due to COVID-19. I have since switched gears a few months ago and primarily do these types of community engagement events in order to interact with people, to answer questions, to address any concerns that they might have around COVID or the vaccine. So with that, shall I kick off and just give a quick verbal update in terms of where we are with COVID in London?
That would be really useful, Hamish. Yeah.
Okay, very happy to. So many of you will be aware of the fact that we're currently experiencing a large spike in people testing positive for COVID in London. London has reported the largest increase in cases over the past month in England and now has the highest rate of COVID cases. Part of this increase is due to more testing, but we know from the ONS COVID infection survey, which has a lag, so data is just a two-week window behind, COVID infections are also rising in London. So again, this dominating the headlines. This increase in COVID is due to the circulation of a more contagious variant, the Omicron variant. This has displaced Delta and is now the dominant variant of COVID in London and elsewhere in England, I'm sure. This variant was first discovered at mid-November. It's clearly more contagious. There's a lot we don't know, but what we do know is that the Omicron variant is more contagious than Delta or other variants such as Alpha. However, there's clear evidence that completing the primary course of 2 vaccines at least 3 months ago provides little protection against becoming sick with COVID, but there is really good evidence to show that boosters increase that protection to 70%. It's still too early to estimate how well the boosters protect against severe illness or death, but it's likely to be a lot higher than that 70%. So back to London again, the peak age group, 20 to 39-year-olds in the past few weeks, and the rates of COVID are highest in the poorest areas of London. And we know that these are also the areas where Black and Brown communities are overrepresented. So in terms of healthcare seeking or healthcare outcomes, the number of people in hospital in London with confirmed COVID is rising, but the number on mechanical ventilation beds is staying relatively stable. So this highlights that pre-existing immunity from the vaccine might be providing some protection against severe illness, and the fact that there are more cases in younger people who are less likely to have severe COVID. So in terms of COVID deaths, the daily number of COVID deaths in London is remaining relatively stable. So again, that's about more COVID cases, COVID circulating in younger people. They have the lowest vaccination uptake of all age groups, but they're also less likely to have severe illness due to COVID. But do bear in mind that many do still fall ill and require hospitalization. Furthermore, and sadly, the disproportionality by ethnicity persists, and nationally Black and Asian populations are more likely to die from COVID than people of other ethnicities. So in terms of the way out and navigating out of this pandemic, we have 4 approved vaccines, 3 of which have been administered. There have been over 15 million doses of a COVID vaccine administered in London. Most Londoners have been double vaccinated. There's a lot of negative spin in the media, but do bear in mind that most, so 62% of Londoners 12 years and older have been double vaccinated. But it is a fact that uptake of vaccination in London is lower than in other parts of the country. In terms of the booster, just over 1/3 of Londoners have had a booster or a 3rd dose. And again, there are really wide variations in vaccine uptake by ethnicity. So just as a case in point, most adults, so 51% of Black Caribbean adults, 58% of Black African adults in London have been double vaccinated, but those proportions are lower than the uptake in other ethnic groups in London. So just to sum up before we go to the panel discussion, people of Black or Asian ethnicity constitute a minority of people diagnosed with COVID, but COVID impacts in our communities to a disproportionately higher degree than others. This does not mean that our communities are responsible for spreading COVID, but our communities are some that would benefit the most from being vaccinated and receiving a booster when called for it.
Thanks very, very much, Hamish. That's a kind of really clear picture that you paint for us. It has sparked about 100,000 questions for me, but I, like everybody else, are going to have to kind of stick them in the chat. And so we're asking participants who want to ask questions to put those questions into the chat, and we'll be picking those questions up with the panel after we've heard from Dr. Debbie Weeks-Bernard, Deputy Mayor of London.
Thank you so much, Michael. And I'm so sorry that I was having such a technical problem with joining this really important discussion. But I'm really glad that I've been able to join you all. And I was really glad to have been able to hear Hamish's opening comments. Are really, really important and really interesting and really informative. I really just want to welcome all of you who are on this call this evening to this really important discussion. Really looking forward to hearing from all of our panelists and from hearing and benefiting from Michael's really great chairing. I've seen Michael chair before, does a really good job of making sure that everybody is able to give a really clear set of explanations and answers to questions that are put to panelists. And can I just take this opportunity to wish all of you on the call, all of your families, your friends, and those who you know well, a very happy and a very safe festive season, because I know that there will be many, many questions that people will have about what they will be able to do or not do in the run up to the start of the bank holidays, and so it's really timely, and I'm really glad that we've had the opportunity to have this this question and answer session for you all at this time. I'd really also like to thank our partners, the Ubele Initiative, as well as NHS London and the Office for Health Improvement and Disparities, who've made all of these sessions possible. Now, I know that many of you on this call, many people have not been able to join us today, will be concerned about those rising cases of the new Omicron variant, as Hamish has gone on to talk very eloquently about, and also worried about the reintroduction of those public health measures, which include mask wearing and testing for international travel. And we are once again facing really high levels of uncertainty. And I really want to reassure those of you on the call on behalf of the Mayor and myself that we are here and we are alive to your concerns. We will continue to do all that we can to support Londoners through these really difficult times and challenges. So today is a really good chance for us to hear about the vaccination programme and what we can all do to try to manage the spread of this new dominant variant. So there's going to be time for our expert panel to answer all of your questions, and I'm sure that there are many. And we've organised this session to make sure that you can get answers to your questions and your concerns. I do urge you to use this opportunity to ask literally anything to our panel of experts, because often the questions that you may be thinking, that you may think everyone will know the answer to, and that you ought to know the answer to, is not ever the case. If you don't ask, you will never find out the answers to the things that are niggling you. So please do ask whatever is on your mind in relation to the vaccination programme and in relation to what's happening here in London at the moment with regards to this variant and with regards to COVID. Following this call, we will share details of where you can go to find useful resources and information that you can share with your networks, with your friends, with your families. And ultimately, it just ends with, it's important for me to end by saying that we know that we can only remain safe together, and that it's important for us to continue to care for each other. And even more importantly for us at the Mayor's office, that we do all that we can in our power to make sure that those health inequalities that have got so much worse for Black and Brown communities during this pandemic do not worsen. So please do share these resources onwards and share any links or resources in the chat that you'd like us to disseminate in the follow-up. And I will now hand back to our host, Michael.
I need to unmute myself. Thank you very much, Debbie. Thank you. And so kind of off, I suppose, into the panel with the first question. And the first question is about the speed at which the vaccine was developed. I know that this is a question on the hearts of lots of people who are kind of refusing the vaccine at the moment, who said it has developed so quickly that it can't be trusted. I wonder, is there any of our panelists that can kind of deal with that question?
Michael, I'll be happy to. This is a question we get very often and something that I'm always very happy to answer, because I think it is a very valid question, and many people would have looked at the development of this vaccine and just wondered how on earth we could have done it so quickly. So as somebody who was personally involved in vaccine trials at my local hospital, specifically the Oxford AstraZeneca vaccine, I know the effort and the regulation that went into ensuring that the vaccine was safe and effective. One of the things I wanted to say about the vaccines that we have is that although they are new vaccines specifically for COVID-19, they're based on technologies that we've had for a while. So the mRNA technology is a technology that's been in development for decades. And what was quite fortunate about this in terms of it being a coronavirus is that because they previously worked on coronaviruses such as MERS and SARS, which are different types of coronaviruses, they were quite easily able to then use a target that they knew about already, so the spike protein, in order to quickly develop this first new vaccine. The important thing to also say about that is that none of the trial stages were cut. So the vaccines went through all the necessary trials that any other vaccine or medication would have to go through, i.e. the preclinical stages, which are kind of in vitro, often in animals, etc., and then into the clinical trials. And each set of the clinical trial essentially escalates in regards to the amount of people you have and the way in which you look at what's going on with the vaccine. So the initial trials are always about safety, and then you look at kind of dosing and finding effectiveness in the bigger trials, so the phase 3 trials. And throughout all this time, there was ongoing discussion with the regulators and ongoing approval of the different stages. The other thing that's really important to know about this is one of the reasons that this was able to happen so quickly is because so many other people who were doing other things prior to the pandemic also went in and started to work on the COVID vaccine. So there was a real pooling of resources, people-wise, time-wise, but also money. Everybody knows money talks, and money really did talk in regards to the approval of this vaccination. So I want to assure everybody that they are very safe and they have been through very rigorous clinical trials. And we're very fortunate to be in the position where we even have a vaccine. But we have to be very thankful to all the scientists and all the different people who were involved in the vaccine development, because it really was like a global effort and a global push.
Sarah, the way it was explained to me once, and I hope this makes sense. I'd like to check with you that this makes sense. That somebody might go into a car showroom to buy a car, but they have the perfect color in their mind, which isn't available. And so the car manufacturer hasn't got to build a new car. What they've got to do is that they've got to create the perfect paint to put on the car that's already created. And so that there wasn't a need to start from the beginning. What they had to do was to just kind of adjust what was there to work with this particular virus. Is that a good description? Does it?
Yeah, that's essentially. I mean, we talk about platform technologies, and the messenger RNA vaccine platform is a technology that you can put in. And actually, what's really good about that, and hopefully will be helpful in the future if we need it, is that with the advent of new variants such as the Omicron variant, we could perhaps adjust the vaccine. And that's what work that's going on at the moment in regards to ensuring that we can update the vaccine if necessary. At the moment, the vaccine that's being offered as a booster is the same vaccine that's previously been offered and has previously been through rigorous trials, etc. But there may be a time in the future where actually a vaccine that you're offered might be slightly different based on the updated or the new variant, or based on maybe even a pan-corona vaccine might soon become available. So there's loads of exciting things in the pipeline. And as a scientist and as a health professional, this is actually a really, in some ways, exciting time to kind of witness, but I can understand people's apprehension about it, and definitely understand that people will be worried, but we're here to reassure you that actually all the steps have been followed.
I can see how excited you are, Sarah. It's really nice to see somebody that's really excited about their work. But listen, let me ask another question that's come in. I'm not going to ask it. I'm going to see if there's anybody else on the panel that feels if that they can take it. But I suppose it's kind of, what are the registered side effects of the vaccines, and yeah, are there any registered side effects of the vaccines? Is that for you again, Sarah, or is that for somebody?
I'm happy to take that. Hello.
Go for it, Io.
So in terms of side effects, all medications, all vaccines have side effects, and these vaccines are no different from other medications and vaccines that have been approved. So the side effects are generally, as clinicians, we divide it into mild, moderate, and more severe. And the mild side effects, you may get a sore arm, you may be a little run down for a few days. Some people have had fevers, headaches, felt a little bit unwell, but usually that resolves within a day or two. The more moderate side effects is that those could go on for a bit longer. And the very severe, very few people have had very severe side effects. And with the AstraZeneca, those were those unusual clots, really weird clots that associated something called HIT, heparin-induced thrombocytopenia thrombosis. So it was a weird effect we saw after we'd vaccinated millions of people. With the Pfizer and Moderna, there's a very rare side effect of inflammation of the heart. So those are some of the more rarer side effects. No medication is without side effects, even the paracetamol. And I think we have to really think about and we do have a yellow card reporting system. So anyone that has what they think is an effect of the vaccine can report, and they have lots and lots of reports, and they're looking for pattern recognition, and they take action. So when the clots, the very rare clot side effect emerged, they took action to then say, let's be on the safe side and say under 40-year-olds, we give them a different vaccine, because we're in the wonderful position that we have choices, which is an amazing position. And it's due to the fact that there was global, political, money will to get a solution to this pandemic. So side effects are there, but we can't take the focus over the complications of COVID infection itself, the significant morbidity associated with COVID infection itself. We have death as the awful caseload. We've seen the numbers on the news with how many deaths per day, but that doesn't talk about the number of people that have COVID, have recovered, and have complications and long-term effects. As a GP, I'm dealing with patients week in, week out with long COVID or post-COVID syndrome. That is a real thing, and we're going to see more of that. So I think a lot of focus have been put on, rightly, people want to have the questions of what are the side effects of the vaccines, but don't take the eye off. The reason for the vaccine is to protect against an infection that has a lot more side effects. So everything is a risk-benefit way up, and the risk of side effects from the vaccine is much less against the risk of potential long-term complications and severe illness from COVID itself. And people can't forget that balance.
Okay, before I move away from you, I've got a question here from Amari, and I think it might be a question for you. Amari says that she's had COVID twice and she's hesitant to get a vaccine because she's scared of having an adverse reaction. She feels that she might be susceptible to the virus, and the vaccine uses the virus's genetic code to offer protection from the virus. How likely is she to have an adverse reaction if she gets vaxxed?
And that's another common concern. People feel they have natural immunity from infection from COVID. So do they need the extra immunity and protection a vaccine can offer? Mm-hmm. And the answer and the recommendation is, even if you've had COVID before, you can still be better protected by getting vaccinated. Don't have the vaccine when you have active COVID infection. We recommend leaving at least 28 days. And we always, before we vaccinate anyone, whether it's baby IMS or any other vaccine, we'll ask, do you feel well? Do you have a fever? Is it safe to vaccinate you on this day? But the recommendation is, think about the vaccine adding to the protection your immune system will have from natural infection. The vaccine-mediated immunity, we think, may last longer and is targeted specifically against the spike protein at the moment. It is safe to have, even if you've had COVID infection before, and your protection may be even boosted even more. So our recommendation is, yes, please go ahead and be vaccinated.
And are you more likely, though, to have
side effects?
To have side effects if you're more susceptible? And I think Amari's suggesting that she feels that she's more susceptible to the virus. And so does that mean that she's more likely to have side effects?
Difficult one to answer because everyone responds in such an individual way. So basically the vaccine is stimulating your immune system. It's getting all those antibodies ready to go if it was to have the vaccine, if it was to approach the virus again. If she feels she's more susceptible, if it's COVID or infection in general, maybe she should think about the wider health issues. Because remember, this vaccine is just helping your immune system do what it's meant to do. It is like your immune system is the one doing all the work, but the vaccine then teaches it what to do. So I wouldn't say she's necessarily more liable to have side effects from the vaccine. We can't say that. Everyone is very different. Generally speaking, people have responded to this vaccine well, and the side effects have been minimal and short-lasting. So, but I would say if she has concerns about her immunity and her susceptibility in general, maybe that's a conversation with her GP about how to keep herself well in general.
Thanks very much. And the kind of last question in this group of questions, which, you know, I've just put them in my head about the kind of science of the vaccine. And that's, somebody's asking, when will the full ingredients of the vaccine be released to scientists in general?
So I could answer that. So just to say that that is a concern in terms of transparency. The good news is the ingredients are publicly available. So they're available in the insert that you receive when you're vaccinated, but they're also readily available online. And I will try during the panel just to find a link. If I can't find it during the panel, I will circulate a link to the chair to share with the attendees. But the information on ingredients for all the MHRA approved vaccines are publicly available and published.
Okay. While you're there, Hamish, are we going to be called to have further boosters, do you think? I see is it in Israel they've started
right,
giving people a fourth jab. Is that something that's going to start happening here?
So it's difficult to say with any certainty. What we have to bear in mind, especially when you compare the UK to Israel, it's difficult to make any comparisons between countries because different countries vaccinate at different stages, different countries have different age profiles, they may have younger populations, they may use different vaccines. So to answer your question, we don't know with certainty the regularity with which we will be required or recommended to have a booster, but we may approach a steady state where we find this for other diseases that are airborne, such as influenza. There is a season that takes place in the latter half of the year. So in the colder months when we're inside, we aren't out and about enjoying fresh air as much as we'd like. For those of you who might be in the tropics, this is the rainier part of the year as well. So when there is a seasonality to these airborne viruses, such as influenza, such as COVID. The reason why we're seeing so much COVID since the summer is because we've just emerged from a really intense lockdown. We were all, most of us were working from home if we could. We were not socializing as much, social venues were closed. So there was this rapid rebound, not just in COVID, but other respiratory viruses such as RSV that took place at an atypical time. So they took place in the summer, and that's unusual. So in other words, as we approach a steady state and we exit a cycle of social restrictions or lockdowns, and we reestablish that seasonality of influenza, RSV, COVID, I suspect, this is just my personal view, that it's possible that we may be called for an annual COVID booster, such as the case as it is for influenza vaccination, which happens on an annual basis for the same reason.
Okay. Hamish, while you were talking, I think I kind of started to detect a Trinidadian twang there. And I'm just wondering, Hamish, if Dr. Fenton was here, I'd be asking him about what's happening in Jamaica and the Caribbean. I know that a lot of our listeners, our viewers, I'm not sure what we call them on Zoom, the people watching you talking will have a bit of an interest in what's happening outside of the UK, maybe in the Caribbean. Do you have an eye on what's happening in the Caribbean, in Trinidad?
Definitely, because it's been difficult for us in the Caribbean for a number of reasons. So the first thing is vaccine availability was not where it should be a few months ago. We're now in a very different position where most CARICOM member states have they're spoiled with choice in terms of a variety of different vaccines being available. Mm-hmm. Vaccine uptake has been slow but steady. Mm-hmm. There is a problem with misinformation and misunderstanding around what's in the vaccine and the impact. So there are real concerns about improving uptake. Mm-hmm. Where there are Caribbean countries that are reliant upon tourism as their major source of income, they have had to reopen their borders at an earlier stage and have experienced spikes in COVID for most of 2020. So the Caribbean is in a very precarious situation in terms of balancing the need to enforce public health recommendations around COVID, such as testing at the border or isolation and testing, balancing that against the economic ramifications of not having that tourism income. Those of you who know Trinidad and Tobago will know that Trinidad in particular is less reliant on tourism, so it's had a longer period in lockdown with closed borders, which makes it difficult to visit family and friends. So the other challenge in the Caribbean is that there isn't access to universally provided testing, so testing remains a barrier. So there will be undetected chains of transmission of COVID. And unfortunately in the Caribbean, there's a high prevalence of diabetes, heart disease. And as a result, we're finding quite a few deaths due to COVID, especially in younger people as well.
Okay, thanks very much. Thanks for that little deviation from the questions which are coming in. But there are lots and lots of questions coming in. And let's see, let's go to, my daughter has been double jabbed and boosted 2 months ago. She just caught COVID for the second time in 5 months. And I suppose that's not a question, but something that's kind of demanding a response. So somebody who's double jabbed and boosted and has got COVID twice since then. And does anybody feel that they want to respond to that?
Shall I take it? I think it's a tricky one. So firstly, I'm really sorry to hear that. I hope she's okay and she hasn't been unwell with it or had to be hospitalized. I mean, there will always, unfortunately, be a subset of people who perhaps don't respond to a vaccine. And we see it in things like hepatitis B, we see it in other types of vaccinations. So that may be one thing. The other thing is that although the vaccine does definitely reduce the risk of severe disease or death and hospitalization, there still is a risk with the vaccine that you may still get infected. You would think in somebody who's had who's been boosted and also had infection, and their immunity would be quite high. But again, we also know that with the newer variant around, that there will be people who, regardless of their previous immune state, will be susceptible to COVID. And we will definitely see that in the weeks and months to come, unfortunately. But the data as it is at the moment suggests that boosting does decrease your risk of infection and helps to improve your immunity or your antibody levels. So it is still worth getting boosted. But for every kind of, I don't know, 100,000 or however many people who do have the vaccine and are quite well protected by it, there will always be a few people who unfortunately are not as well protected. But I think the most important thing for your daughter is that she's well, and I hope she does remain well and that she remains safe.
Sidi, do we know how many people are in hospital with COVID at the moment?
Yeah, so I think the most recent numbers are about 8,000 people across the country. This is actually obviously much less than it was during kind of the peaks of January and the years before. But I think the other thing to say is when you see numbers like 100,000 cases a day, often there will be a lag in terms of the proportion of people who then end up in hospital. Normally, in the first couple of waves, we were saying probably 2 to 3 weeks, some 10 days to 3 weeks in regards to lag of people who get infection, are unwell, and then become unwell enough to come into hospital. Sometimes it's faster, sometimes it's longer. And so I think we've seen numbers as they are at the moment. There's a real worry within the NHS, coupled with the idea that obviously there's staff sickness, that we will be overwhelmed coming into the end of this week, post New Year, etc. as well, given the large numbers of cases we are seeing. So it is a worrying time ahead, and I think the most important thing is that people try and stay as safe as possible.
Thanks very much. Sidi, sorry, wrong question for you, but the right question for you is health inequalities. How are they impacting on what's going on at the moment?
Thank you, Michael. And I'm sure all of our panelists will have lots of data and information about the impact, the disproportionate impact of COVID on Black and brown communities. This has been a challenge throughout, and the fact that we have lower take-up numbers in London is really exacerbating that. The work I've been asked to lead on with Kevin Fenton, Debbie and others is to start thinking about how do we use all of the information that we've gained during the vaccine period, all the work that's been done to build trust in communities, local people, local places, build that trust. How can we use all what we've learned to go forward and reduce health inequalities through increased take-up, not just of the COVID vaccine, but flu, health screening, the numbers across London of people of our communities that take a full part in all of the health screening programs that are available to them. The vaccine, the flu vaccine and other immunization programs is very, very low. Now, what we've got to try and do, and this is a long-term challenge, opportunity, is to build trust in those communities so they are more willing to engage in programs like we have seen. It's now over a year since the first vaccine was administered. In parts of London, the take-up amongst our communities is potentially as low as 50 to 60%. So when the national figures are shared, that hides the fact that in certain areas of London, the take-up is very, very low. And we've got to change that. We've got to somehow create a new narrative, a new paradigm that people think, actually, I want to take the flu vaccine because I know it will be good for me, good for my family, and so on and so forth. And we're nowhere near that, but that's the challenge that we have. Otherwise, this situation will continue to devastate our communities. And I use that word advisedly. Mm-hmm. And as part of the work that the NHS are doing in London, there's an absolute commitment to build on what we've learned, to take it out into communities, to start talking to communities, to say, how can we get messages across to people in ways that they're willing to then engage? So one of the things that I've done is put forward the idea of an advisory group that will work with colleagues from local authorities, the GLA and the NHS to frame how we might take forward some of these discussions, because in the long term, that's what we have to do. Otherwise, the situation is going to continue to devastate our communities.
Thanks very much, Sidi. We have a question from Io. Io, I think, is going to speak her question herself. Io, are you here? Hello.
Hello, can you hear me? Sorry.
Yes.
Hi. Thank you for letting me speak. I really appreciate it. Just for background, I'm a final year medical student at UCL, so it's been really useful for me to listen and understand kind of what's been the kind of different approaches. I've also got kind of like a background in political communications, so I wanted to ask, going off of that, one thing I have noticed, because I do a lot of like grassroots work, I'm working with Black organizations and like ethnic minority organizations, is that I've had people asking me, basically, that I feel like what people have found is they're quite confused. So the issue they're having is that they see the government, the media, the NHS, and all of these different kind of like entities and institutions as molded into one. So they see them all as one. And I think what has been happening is that I've had people from said organizations or just in the community come to me. I usually redirect them to like formal advice, to speak to your GP, but I think one thing they've been struggling with is how can we differentiate between all of these different bits of public health advice that we're getting? Because I think, for example, the distrust, I think, for a lot of people with the vaccine and just generally public health messaging is that, if we're being honest, if we look at the government and the way some of their public health messaging has been, it's been all over the place. Especially, for example, we just look at masks, as in take it off, put it back on, take it off. And when you see government officials not having it on, it decreases the seriousness of these things. So I think, yeah, that's my question is, how can we create communications and messaging that people can trust, but also, I guess, kind of creating an atmosphere where you know, we can, when things that are wrong are done, it is done. Because I think a lot of the messaging I've seen, particularly from the NHS, has been around, I think, some of the more easily disproved stuff about 5G and these things, 5G and these things. But I think what I'm seeing more is that people have a distrust and there's a confusion, especially if you have maybe a different professor or a different institution or different media publications reporting on different things and coming on TV and speaking about a range of topics. People are getting confused, if that makes sense.
Thank you, Ayo. Sidi.
Just to come back to that, and I think that's a growing realization. So efforts that have been made during the first vaccine rollout program has been to try and engage with local communities, because as I've described it, it's about trusted people and trusted places. So that's why so much work has been done in communities where people have confidence in the people that they're talking to. They may not have confidence in the institution that is the NHS, and we hope that will build over time. But the efforts that have been made during the COVID vaccine rollout has been through community champions. There's been a lot of work. The GLA have been involved, local authorities have been involved, the NHS have been involved. There's been a lot of investment in terms of supporting people. So it's not local people talking to the faceless NHS, it's local people talking to their community leaders, people that in their church who had great support from the from pastors and others, faith communities right across London.
Thanks, Sidi. Patrick, you've got your hands up for this one as well.
Yeah, thanks for your question, Ayo, and great that studies lead this work. I mean, I've worked in the last 20 years as a senior director for the NHS. I've been on boards of NHS organisations, GP cooperatives, health authorities, mental health trusts. I've sat on various advisory committees around this matter of healthcare. The basic problem that we have, everyone, is we are doing great efforts to get people to take the vaccine, and it's important that we do take the vaccine. But one of the reasons why I think a lot of people are, and I hate the word hesitancy, it's not hesitancy, people are quite clear about their choices they're making. We may not agree with those choices, but they've gone through a process of reflection and why they're not taking it. But one of the reasons why there's a massive gap, and I live in Hackney and the levels aren't that fantastic in terms of Black people taking COVID. Also, if you look at Birmingham, I'm involved in the Birmingham Solihull ICS, it's the same issue. Black people aren't taking it, basically. And one of the reasons why we're not taking it is if you look at other health considerations, such as the shocking levels of infant mortality in the Black community and the way that Black women are treated in the NHS around maternity services for the last 25 years. If you look at the overrepresentation of particularly Black men in the SAMCAP system for the last 30 years, if you look at the poor quality of care around support around people with diabetes, coronary heart disease, and then particular things like around sickle cell, it's not surprising that people are hesitant. So the question is not so much about, yes, we have to get people to take the vaccine, but it raises a fundamental question that since the NHS has been going for the last 74 years, and we were there at the very beginning of the creation of the NHS, by the way, it's not reflected in workforce development, it's not reflected in having more Black and brown people in senior management roles. We've got a handful, but it's not good enough. By now in London, if you look at London as a health system, we should have at least a dozen Black chief executives running at senior levels. You can't just rely on poor Kevin Benton all the time, or Sedi as a Ned, as a chair. You know, that's one thing. And on top of that, if you look at the RCN, they've done loads of reports over the last 7 years looking at racism and bullying of Black nurses in NHS. That's why a lot of Black nurses are really been told by the manager, you got to take the vaccine or else. And if we're going to have this situation whereby people are now going to be forced to lose their jobs because they're not taking the vaccine, that is going to have a disproportionate impact on the Black community, as you know. So the question of trust is important, but the problem is the other part of the system needs to get its act together around maternal health, mental health, and other aspects, and that will build the trust and confidence. Otherwise, we'll have a situation whereby more of us, sadly, and will die of COVID and other related diseases connected with COVID as well.
Thank you very much, Patrick. And so with that context, and with the context of what I call kind of racism in the United Kingdom, we still have a key message around Omicron, around COVID right now that we need to be sharing with the Black and minoritized communities of London and the rest of the UK. I wonder in our last, because we only have 5 minutes left, if each of you perhaps literally 20 seconds to say what your message would be to the Black and minoritized people of London and the Black and minoritized people of the United Kingdom. And we'll start with Hamish.
Thank you. So just a couple, 20 seconds, I'll try my best.
Literally 20 seconds. I'm going to get really rude and kind of wave my arms around if you go.
That's fine, that's fine. So I will say this, now is the time to act. There's a lot of misinformation out there, but there are official sources. So use official sources for data on COVID, seek medical advice, or attend forums such as these if you have questions about the vaccine. If you've been vaccinated, share your experiences with your network, with your friends and family, and spread the word on how to prevent COVID-19. So the best way to reduce that risk of severe illness is through vaccination.
Sarah? You're on mute, Sarah. You're on mute, Sarah.
There's a delay with my apologies, transatlantic. I really struggle to be brief. I mean, I think for me, the first thing I always would say is please get the vaccine. As somebody who has spent time researching and looking into the health inequities and the reasons behind why we're less likely to get vaccinated, I fully understand the other reasons why people would be apprehensive. However, I'm here as somebody, a person of colour, a Black person, a Black doctor who's grown up, lived in London all of my life, to say that I've seen the effects of COVID. I know the benefits of the vaccine. I really would encourage everybody to please get the vaccine.
Okay, I'm going to change the question up a little bit for Sedi, because there's a question at the bottom of our questions list right now, which is, Sedi, same question, but I think spoken slightly differently. Many people are feeling bullied and pressurized into taking the vaccine from the applied psychology, by the psychology being applied by government, mainstream media, work colleagues, family, friends. Grace strongly feels that personal choice is being taken away.
Well, clearly personal choice is not being taken away because people are choosing not to take the vaccine.
Mm-hmm.
My message, I'm conscious of time, and I'd like to hear Oge, because she'll have much more to say than I will, and I'm sure Debbie will have a word to say. It's all about trusted people, trusted places. Seek out the people that you trust, talk to them. If they can't answer, ask them to find someone who can answer. Trusted people, trusted places.
Okay.
Thank you. And for me, it's everyone should weigh up the information critically. So if you get a WhatsApp video or a message that says one thing, go and look at the counter view and really weigh up the information and then find out a trusted person to really talk to. As a healthcare profession, as a Black healthcare professional, we are seeing people, you know, Black and brown people in hospital with severe disease. It breaks our hearts. My hospital colleagues are traumatized by what they're seeing at the moment. And we would not be doing our jobs if we didn't tell you the definite risk of not protecting yourselves. So beyond work, beyond, you know, feeling coerced, this is about protecting yourselves. And we need to have the conversation. I'm so excited about the legacy work that's going to be done, because beyond the vaccine, health screening? Why are we at the bottom of that, you know, chain, as it were, in terms of the numbers of us taking up breast cancer smear tests, all of that? There's a lot of work and a lot of conversation we have to have with ourselves. And I really hope we'll have more of these forums for honest conversations, you know, for us, by us, whichever terminology you want to use.
My arms are waving, my arms are waving.
But number one, please get protected for you. We want to see you safe. Thank
Patrick.
you.
Yeah, I took the vaccine very early, and I did lots of social media messages, and a lot of people contacted me. Number one, I wanted to make sure I was still alive, and no, seriously, people I hadn't heard for years were ringing me saying, "What's that message, Patrick? You're there." And I've convinced lots of people, talk to people. As I said, it's just talk to people making the choice themselves. But I think what needs to happen in this legacy work is about community and patient advocacy. That's what's missing. We need to have more advocacy. I mean, I was involved when Health Watch England was established about 7 years ago. But we need to, hello, Michael. We need some more advocacy work and patient engagement work. And then we can influence the screening agenda as well. Sorry.
Thank you, Patrick. I'd like to thank all of the panelists for joining this afternoon. I'd like to thank everybody that came on to the call and listened to the incredible sharings from the panelists. I'd like to leave us with some words from Debbie Weeks-Bernard, who's the Deputy Mayor, for London. Debbie.
Thank you, Michael. And I will be really quick. Thank you so much to our panelists. Thank you so much for all of those answers that you gave to those questions. Really important, informed advice and guidance. And thank you to all of you for asking those questions. They were all important questions. And we will be sharing further resources and information after this event. And this is the first of many that we are going to be having over the next couple of weeks. We are determined to make sure that we are there answering the questions that people have about the vaccination, about COVID, so that we are as protected as possible as a community. As far as I'm concerned, I do not want those health inequalities that our communities are experiencing to get worse, because they are already quite wide. And the best way that we can try to reduce those inequalities is by keeping ourselves safe, is by taking up the vaccine, but also by asking those questions and having those questions answered so that you feel that you're making the right and the informed choice that you need to make. So thank you all. Please keep asking us those questions and we will continue to advocate on your behalf. Thank you all.
Thank you. Good night.